expert advice on various issues connected with hair care. Our hair is our crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention, which we often forget and end up neglecting on our hair. Earlier, thinning hair, bald patchy hair, and hair loss were problems that were noticed in middle age and older people. However, with increasing bad lifestyle choices, poor stress management, environmental pollution, we are now seeing hair problems even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Preeti Reshamwala is a respected doctor based in Surat who specializes in dermatology. She has been practicing medicine for over 12 years now. She currently practices as dermatologist at Baps Hospital Surat. She has wide range of expertise in diagnosis and management of skin and hair related concerns. Also proficient in laser treatment, PRP, injectable procedures like Botox, filler, threads, advanced treatment like radiofrequency, HIFU for skin tightening, mesotherapy, hair transplant with FUE transplant technique. Dr. Preeti Reshamwala is cognizant of the need for the patient awareness and education about hair care and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Preeti Reshamwala, for sparing your valuable time to answer a few questions for us today. Welcome to the show.
Thank you. It's my pleasure.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to discuss the hair care in current scenario. So, when we talk about hair care, the first question comes up to our mind is hair loss. So, now everyone is facing hair loss problems. So, what's normal and when to be concerned for?
Absolutely. Now, hair fall and hair loss are two different aspects. Hair fall is when you just see hair strands on your pillow, or when you just comb your hair, it is falling off, right? And hair loss is actually a pathological problem wherein it's known as alopecia. Now, alopecia again are of different types, but first I will stress on what you mean by hair fall. Okay, so normally a hair cycle is whenever there is a hair into a follicle, it grows for at least 3 to 4 years. So it is a natural phenomena that the old hair will shed off and a new hair will come in the follicle. But when people panic is when they see a sudden hair fall happening, means they see strands of hair on the pillow or when they are combing or shampooing. So for us, when we say it's a normal hair fall, a hair fall of a count of 100 is said to be normal. Beyond that, if you see a hair fall happening, it is abnormal. Apart from that, those who have a little scanty hair and they can start seeing the scalp, that is also an alarming thing wherein we say that yes, that is hair fall. So these are the few concerns which people come up with, or the patients come up with. Yes, I am seeing a lot of hair fall, when it will be minimal in our case, but they can actually see the thinning hairline, or they can see the scalp being visible. So that is where they say that it is a hair fall problem that they are facing. Other thing is a hair loss, wherein we call it as alopecia. Now, alopecia again are of different types. So that is a pathological problem, wherein it could be related to like an alopecia patch. It's a small patch happening on the scalp, or an androgenic, that is a male pattern baldness seen in males. And in females, we call it as a female pattern baldness. And sometimes it can be also related to the physiological, like pregnancy or post-delivery, where people see a lot of hair fall happening. Sometimes it is related to very illnesses, like we have seen post-COVID, a lot of hair fall happening, which is leading to hair loss as well, and balding patches. Some people who are on intensive therapies, or those who are suffering from thyroid or some nutritional deficiencies like iron deficiency, anemia. So these are few common physiological problems which also contributes to the hair loss and the hair fall concern simultaneously. Again, you can also consider those who are on cancer treatments. So that is again a different type of hair loss, wherein we call it as an androgenic alopecia. So that's a hair cycle which is basically disturbed, and that is where the hair fall and the hair loss go in combination and leading to a bald patch.
Okay. Very informative, doctor. So, yeah, like, what are different or general causes for hair loss?
Okay, so if we have to classify between, or say in a broad term, a male pattern or a male concern of baldness and a female concern of baldness. So first, I would say that it's a general thing wherein the lifestyle is a very major concern now. Like if you, as you said, like the young people are also facing this problem nowadays. Initially, we used to see just those who are in the late 40s are having a hair loss concern, but now we are seeing the trend that it is increasing at an alarming rate. So this is, I feel, mainly related to the lifestyle. Now we see young students coming with hair loss. We have students like just at the age of 18, 19, male patients who are coming with a receding hairline. And I think that is something which is very challenging for us. And we need to make the people aware that this is purely related to their lifestyle. Yes, there is a genetic component, but lifestyle plays a very major role. So like their eating habits, their sleep patterns, like they are eating a lot of junk food, plus they are traveling, they are migrating, students are going abroad for studies, and that is also causing a lot of disturbance in their nutritional intake, plus their stress, like the amount of competitive exams that they are giving, leading to the stress. Then the migration again is one concern, wherein they are shifting from one city to another, the change of water, their eating habits, like they are accustomed to some type of food, and when they migrate to another place, they are not getting what they actually need as a nutritional food. They just take in whatever is easily available, like the packaged foods, frozen foods, and that is absolutely just zero calories. I mean, it's just high in calories and zero nutritive value. So these things, I think, are a major concern as far as the lifestyle is concerned. Plus, the youngsters, they tend to sleep late, the sleep patterns are disturbed, the entire circadian rhythm has been changed. So they sleep at late nights and are not able to get at least 6 hours of undisturbed sleep, which again leads to hair fall. Plus, the water change also is a contributing factor. Then the amount of changes in the shampoos that they take. There are so many over-the-counter shampoos which are available, and they just follow blindly whatever is available on the counter, and they use it. They just feel that okay, this will help me to take care of my hair, and that again causes rebound hair fall. So a proper understanding of their hair loss problem as well as the hair fall is very much vital, because they need to understand why this is actually happening. So it's just not a simple thing like just like a dry skin. It's a very problematic issue, and they need to have a proper guidance. So a proper lifestyle, what nutritional foods are to be taken, how what are the right shampoos to be used. Again, if they're having any dandruff problems, then that is also another aspect leading to hair fall, which is again growing at a very alarming rate. Again, as I said, like this is one of the aspects is the lifestyle. Secondly, if we see in females, the nutritional intake in females is very much erratic, because we see a lot of iron deficiency anemia in patients, particularly female patients, because of their eating habits. Like they do not take very nutritious foods. They first consider their family and then themselves. So that is the reason I feel that that leads to iron deficiency anemia, which is very common, particularly in Indian women, I would say. Like if you see any second or third Indian women, if you do the HB level, it will be low. So that is also a key factor for the hair fall, particularly in females. Again, the type of chemical treatments that the youngsters undergo, particularly females, just to adjust to their professional aspects, or maybe just to look good, or the influence of the friends, they go in under chemical treatments like rebonding, smoothening, straightening, hair colors, tinting of the hair. Again, the type of shampoos that they use to maintain it, this again contributes to the hair fall, because the chemicals used in the straightening and smoothening are again very harsh chemicals, because they need to break the bonds of the disulfide bonds, which we say, which is again going to contribute to the damage of the hair as well as hair fall and hair loss. So this is one aspect. In males, if we say that, again, as I said, lifestyle is one, yes. Genetic component is one more aspect which contributes to the hair fall, which we call as androgenic alopecia or male pattern baldness, which is one is again the genetic component, as we say that they have it from the ancestors, like their father, their uncles have a problem of balding, and that has come down to them. So there also, in this case also, we are seeing many young people who are facing this problem. So I would correlate this also to the lifestyle. So these are the few common problems that we see, and I think that they are the key reasons why this hair loss and hair fall problem is growing at an alarming rate.
So, doctor, like you are saying that the person's lifestyle is play a vital role for the hair health.
Yes,
So,
yes.
doctor, can a person's sedentary lifestyle also play a role in the hair health?
Absolutely, absolutely right. See, when there is a sedentary lifestyle, you lead to obesity. Like there is a lot of putting on weight. So, and they just tend to binge on things. So again, when they are putting on weight, they are stressed that okay, I'm putting on weight and I'm getting stressed. People tend to get stressed about the overweight, and that also leads to hair fall. Apart from that, the type of food that they take, that we call it as high glycemic foods. So what I mean by that is a lot of carbohydrates in their diet, which is converted to sugar, and that sugar overall hampers your means it disturbs the entire metabolism, and that again leads to a lot of acne problem, oily scalp, oily skin, and dandruff, increasing the hair loss problem eventually. So I say eating a healthy diet, getting up early, giving a time to your exercise, maintaining a good lifestyle is very, very important if you want to control this problem at an early age and at the right time. So this is again one of the contributing factors, as you rightly said.
Okay, so like regular consultation and healthy lifestyle can help to have
Yes,
a healthy.
absolutely.
So,
Very
Doctor, very informative. So, next, when we are talking about lifestyle, hair loss, so the another question which comes up to the mind is like, what are the medical treatment options available for hair loss, like topical or surgical or non-surgical or oral? So, what are the options available for the hair loss?
certainly. I'll guide you for that. See, now, first and foremost, a proper diagnosis is very important. Rather than going to the solutions, I feel first thing is the patient coming to the doctor having a trichoscopic examination. Now, this is like a scope examination wherein we look into the roots of the hair, at what stage the roots of the hair are, and if there is any dandruff. Now, dandruff is again of two types. There is an oily dandruff and a dry dandruff. So both treatments vary accordingly. Apart from that, if it's a female pattern baldness, again we have to see the nutritional part. So that is one aspect wherein we check for the hemoglobin and the iron concentration. Of course, thyroid is also one thing which we commonly see in females, and we get that also checked. Again, if it's a female patient and she's having something known as a PCOD problem, which is again very commonly seen now, that also leads to a balding of the or the hair loss problem, wherein we need to get a hormone profile done. So this is the investigation part. In males, again, if it's a male pattern baldness, we need to see the grading of the hair loss. Like there is a grade 1, 2, 3, 4 accordingly. Now, particularly if it's a grade 1 and 2, we can just control it with medications, oral medications, and some topical application, which I'll just tell you in a few minutes. Apart from that, if it's gone to grade 3 and 4, wherein you can actually see a bald patch and it's shiny, so there means there is no follicles over there. So there, even if you apply any solution or any topical applications, it's not going to give any growth in that area. So for that, hair transplant is the thing. But yes, we can prevent the hairline from receding further. So speaking for the male patients first, I would say that once we analyze the grading of the hair and other issues, if we just say that if it's of just grade 1 and 2 or maximum to 3A, we can consider for something known as PRP along with topical and systemic medication. Now, what is PRP? It's known as platelet-rich plasma, wherein we are using just your own blood, just around 10 ml of the blood is used, and we process it. We first take it into a tube which has something known as biotin, which is already a content in the test tube. Biotin is something known to strengthen the roots of the hair, which is present in the test tube. And then we take the blood and it is processed, wherein we separate the plasma and it is injected into the roots of the hair to basically strengthen the existing roots. So we are basically giving nutrition to the existing roots of the hair. Right now, we do need a couple of sessions for that. We usually recommend around 5 to 6 sessions at a gap of one month, which helps to control the hair fall to a good extent. And over a period of time, it also helps to stimulate new growth. But hair fall and hair growth, helps. It takes around 6 months. It's not going to be that within a month you start seeing the hair growth happening, because it's a cycle which is disturbed. So the cycle to be rectified takes 6 months. 4 to 6 months is usually what we see in each and every patient. It can be a little lengthier also. But yes, if you have a healthy lifestyle along with the medications and topical applications with PRP as a supportive treatment, you get good results. Apart from that, we also do something known as mesotherapy, wherein these are concentrates of biotin as well as saw palmetto, which are used in ampules, and we load it into syringes and again give it into the roots of the hair, either to a dermapen or through a mesogun. So that is again providing nutritional to the roots of the hair, right? And as I said, hair transplant is the last resort. Dandruff again is one issue wherein, as I said, if it's a seborrheic dermatitis, that is a sticky type of dandruff, the treatment varies because there you need a medical treatment, some medical shampoos, topical applications are recommended, which we check and then give accordingly. There are different group of medicines required for them. Then if it is a nutritional problem, as I said, if we detect iron deficiency anemia, then we check the ferritin levels, how low the iron deficit is, and then we need to give them iron supplements. Along with that, some other supportive treatments, which has basically something known as biotin, zinc, calcium panthenate. So these are a few combinations which are required for strengthening the roots of the hair. Apart from that, there is also vitamin D deficiency, vitamin D. So that is also seen because of people staying more indoors, playing on the mobiles and all. People don't tend to go out, and that is also leading to vitamin D deficiency. So we do need to supplement them with vitamin D as well. So if we feel that the vitamin D might be quite low, then we do need to check that up first, and then according to the levels, we might need to give injectable vitamin D3, or even oral if it is just borderline, or if it is just minimally deficient, then oral vitamin D is also recommended along with calcium. So if your vitamin D is less, and if you just keep on giving calcium, it's going to be of no use, because vitamin D is required for the calcium to be uptaken. So if your D is low and you're just popping in calcium, it's of no use, it's just a waste. So we need to get that also checked. So these things are it's going to be go hand in hand, along with some topical applications like again minoxidil along with finasteride is is something which is going to help to improve the growth of the hair, particularly in male pattern baldness. And again, when it's in a very alarming stage, we usually don't start minoxidil. We consider something known as peptides. Peptides are again something known as redensil and capaxil, which are again nutraceuticals, which we can call it, or pharmaceutical products, which help to control the hair fall to a good extent and strengthen the roots of the hair. And minoxidil, because it has a vasodilatation effect, it helps to improve the growth as well. So that we give it as a second resort. I usually do not start it initially. I take it as a second resort, because these things are very important. Again, for females, the treatment, as I said, varies according to the iron deficiency anemia. We need to take care of that. And usually I prefer peptides in female pattern baldness, which, as I said, redensin and capaxil gives better results in females considered to the males. So that's how we need to classify and give the right treatment and at the right time. That is also equally important. So that's about the treatment part. And what are the other options which I told you for that?
Very informative, doctor. I think we are quite enlightened with the medical options available for hair loss. So, doctor, like you said, nutraceutical. So, this word is coming into focus nowadays. So, what is actually nutraceutical, and what is the role of nutraceutical in hair health?
Yeah. So nutraceuticals are something wherein these are concentrates of, as I said, concentrates of biotin, zinc, copper, some amount of amino acids, essential fatty acids. So these are again like a building block of the hair. And so these are given as supplements, maybe in a topical form or in oral forms. Like usually what we usually practice when we're giving into practice, it's usually in the oral supplements. So this is a combination of mixture of something known as biotin, zinc, copper, melatonin, L-arginine, essential fatty acids like omega-3 fatty acids. So these are a combination of tablets incorporated in a oral supplement, like maybe a capsule or a tablet, which is going to take care of the vital deficiencies which are happening in the body, which is also going to contribute to the hair loss. So this is given as a supportive treatment to the existing line of treatment that we usually give. And yes, we do see promising results with this as well, because these minerals and vitamins are not easily available in the day-to-day foods that we take. And looking at the type of processed foods that people eat, initially people used to eat eat something which is very home cooked. But now, because of the processed foods which are being consumed on a wide range, these minerals and vitamins become deficient in the foods as well. So we
Mhm.
need to supplement that with with oral medications, and these are a few formulations which are available nowadays.
Okay. So, doctor, like you are saying that vitamins and minerals, and we don't eat home cooked food. So, what are some of the vitamins can be used for the management of alopecia?
Okay, so as I said, one is the key mineral which is required is iron. Okay, so iron, if you want to say from the food aspect, iron is very high in like spinach. Then like if you're talking about the food elements, then spinach, beetroot, then dates, raisins, figs. These are very high in iron. Even jaggery. These are very high in iron content. So we time and again say that you should be taking care these in a regular basis to improve your iron levels. Apart from that, some amount of minerals and vitamins are also seen in fruits. So all type of fruits are recommended to be taken on a daily basis. Now again, coming to the omega-3 fatty acids, so we recommend nuts which are very high in iron, like almonds, walnuts, pistachios. Then you have hazelnuts. Then the all types of seeds which are like sunflower seeds, flax seeds. These are again very high in omega-3 fatty acids, which are going to help to strengthen the roots of the hair, and that can be taken on a day-to-day basis. So this will also help to take care. And again, milk products like which we say even protein is one of the key reasons to improve the strengthening of the hair. So protein intake is also equally important, but in a natural form, not the whey protein, because that again tends to cause alopecia and hair fall. So we say natural proteins, which is available from soya bean, from all the pulses and grains which are there. Then you can have paneer, that is that's known as cottage cheese. Then curd, buttermilk. All these are good forms of protein. Milk normally we tell to avoid those who are having a PCOD problem, because that again has a very high glycemic index, causing an acne concern. And we have seen that is interrelated to hair fall as well. So plain milk we tell to cut down, but you can supplement it with curd and buttermilk, which is much more helpful and beneficial for both the problems as well. So these are a few tips which I can recommend for the youngsters as well.
Okay, okay, quite informative, doctor. So, doctor, like vitamins, so like minerals also like iron, zinc, copper, do they promote hair growth?
Yes. So if you see like those who are having a little split ends or brittle hair, there we do say that biotin, zinc, and copper, these all are deficient. So as I said, like if you take a good amount of pulses and dals and all, which is very high in zinc and other minerals. So that is also going to take care of this. But yes, you do need to take supplements as well, because everything, as I said, is not available in the natural food. So if you are having very dry, frizzy, brittle hair, then these supplements are equally required. Because if your hair is unmanageable and it tends to break, that also leads to hair fall. And if these deficiencies are there, then you need to replenish it with oral supplements as well.
Okay. So oral supplements are if you are
Recommended.
recommended if
Yes.
for a poor dietary
Yes.
reasons.
Yes.
Yeah. Okay.
Keeping
So
the texture of the hair as well accordingly. Yeah.
okay. So like doctor, you said it's these vitamins and minerals are required. So like is it required to take these nutrients as per gender RDA requirement, or just can take it as much as and have a
No,
good?
certainly that's a good question. Like RDA is the recommended dietary allowance,
Okay.
wherein there is a specific what to say, the concentrations which are to be taken. So when you're taking a supplement, the entire thing is written on the back of the supplement. You can just see what is the content of the gram, and the like if you say folic acid, vitamin B12, they have to be in micrograms and the right amount. Because see, if you're taking excess, is just going to be a waste to the body, because the body also needs to remove it out, take what is required and remove the excess. So the right amount of nutrients taken are equally important. Only then will you get the best benefits. If you're taking a sub optimal level, and you will not get the benefits. So that is the reason that these the nutraceuticals, the capsules or the tablets which are available are according to the RDA. And so they are scientifically tested, and then put under trials to see the efficacy of that particular formulation, and then rolled out into the market, and that definitely helps to control the hair loss to a good extent.
Okay, so instead of taking blindly, we should follow the RDA requirement, take these
Yes, yes,
supplements.
yes, yes, very true.
Quite interesting, doctor. So, like we have talked about like lifestyle, minerals, vitamin diet. So nowadays, everyone is facing problem of stress, and like everywhere, work environment is full of stress. So, what is the impact of stress on hair health?
As I said, if you don't, if one is stressed, then they don't get enough sleep. And as I said, if the sleep is disturbed, then again what do you say? The type of nutrition what you eat is not absorbed by the body, and
Mm-hmm.
that again causes a stomach upset, and all the other factors come into contribution, leading to the hair loss. Okay, so if you're stressed out and you're not eating the right amount of food, you just tend to binge in things, and not in a healthy way, having some like again smoking, drinking, this all tends to crop up and causing more of the hair loss issues. So stress is like a vicious cycle. Stress, hair loss, and other health related issues is a vicious cycle. So I feel that managing stress is very, very important. Maybe by, of course, taking care of the key, what is causing the stress is something which you need to target first. Apart from that, you have to maybe some amount of exercise or some amount of some recreational thing which can control or bring down the stress levels, and some amount of yoga or meditation can also equally help to take care of the stress, and that eventually might help to control, take a good amount of good nutritive food, and eventually take care of the hair loss concern as well. So I think stress is also one of the key reasons or something which we need to target when we are doing a counseling for the hair fall as well.
Okay. So, Doctor, like we are talking about stress. So, when we are stressed at home, working from home, so our mother always say, get a massage done, take a oil therapy or massage. So, do you think oiling can help in a hair health, or oiling hair is a ban or a boom?
Okay. See, oiling itself has its own pros and cons. Now, if you have a very dry, frizzy hair or a very damaged hair, then oiling is recommended. But again, people tend to do a lot of massage to the scalp. Now, when we say a damaged hair, that means even the follicles are weak. If you do a too much of handling of the follicles, that is going to cause the roots to become still more weaker. So we say that when you apply oil, it should be only on the strands of the hair, not on the scalp. Again, those who are having a dandruff issue, we say oiling is a total no-no, because oiling tends to worsen the dandruff still further. So if they just want the hair to be like the strands to be a little more manageable, then they can apply oil down onto the strands. And again, dandruff, if you're having dandruff, then we recommend that apply oiling just an hour or two before the shampooing. So apply oil before you shampoo, and then just rinse it off. First with a normal shampoo and maybe an anti-dandruff shampoo as well, then you're having a seborrheic dermatitis or a dandruff issue as such. Apart from that, people tend to apply oil in a good amount of, like they literally, it will be like sticky hair, and
Yeah.
like a good amount of quantity of the oil, and they feel that okay, when I'm applying good amount of oil, that is required for my hair, and that will give me a good result. But what eventually happens is you tend to use more shampoo to get rid of it. So that worsens the condition still further, and it makes the hair more dry and frizzy. So we say just 1 tablespoon of the oil is sufficient. Apply first on your strands, and whatever is left over, you apply onto the scalp, and then just a tingling massage for just a minute, not more than that. And
Okay.
usually we recommend that you apply just 2 hours before the oiling and then rinse it off. Don't leave it for the entire day or for 2 3 days, because the more the oil, the more it attracts the dust and the dirt, and that creates more dandruff. And again, making the, because it clogs the pores and causing more of the what is it, the hair fall concern. So regular oiling may be recommended maybe once in a week or so, but just 2 hours before shampooing and then rinsing it off. And
Quite.
again, oil, different types of oils are available. So I usually just recommend a normal coconut oil or an almond oil. Almond oil, particularly those who have a very dry hair, then almond oil is good because it has omega-3 fatty acids. Omega-3, so it's rich in vitamin E, which again helps to take care of the dryness. And those who just want a normal oiling, then a normal coconut oil is good enough. And sometimes if you're having a fungal infection or so, maybe once in a while you can use a sesame oil because it has antifungal properties. So these are some tips about the oiling part as such.
Okay, okay. Quite interesting, doctor. कि भर भर के ना लगा के just apply a little bit and get wash it off
Yes,
instead of keeping
yes,
it there.
yes. And it should be only with your fingertips, and it should be a little lukewarm when you're applying, just so that your fingertips can handle it. It should not be used with cotton, just
Okay.
because when you use with cotton, first of all, the oil gets into the cotton, and you're just wasting it. And plus, when you're using with fingertips, so that's the right amount of temperature of the oil which your hair can accept. Because if it's too hot, that can again damage the follicles still further. So that is also one concern which we tell.
Okay, okay. So, doctor, what is the important tips for healthy hair?
Right. So, first and foremost, like if you're having any issues, take the right guidance at the right time. Show a trichologist who will be analyzing your roots of the hair and checking it exactly where the problem lies. Again, a healthy lifestyle, a healthy diet, and getting up early, giving time to yourself, doing some amount of meditation or some exercise so that your metabolism is equally improved and so that you can eat well and whatever you eat is taken up properly. A healthy diet, what I mean by that is a good amount of protein, minerals, vitamins, less of carbs. So that again is going to help you to give you the right nutrition. Water intake is very much mandatory. We recommend at least 2 to 3 liters of water on a regular basis. And regular shampooing is very important. And usually shampooing, we usually recommend a sulfate-free shampoo. So that sulfate-free is basically a regular shampoo which is not very harsh to the scalp. And we call it, when we say sulfate-free, because the chemicals used in them are very, very minimal, and that helps to rinse off the hair quite well without causing any damage. Cut down on chemical treatments as much as you can. If you have to do something just for an occasion, use temporary treatments rather than going in for strong chemical treatments, because they definitely damage the hair in the long run. And apart from that, like choose your product sensibly. Just don't follow the trend. Use it. Choose what is required for you. Take the right guidance and eat at the right times. Don't take late night dinners and just binge on things which are just available. Eat a healthy diet. Eat a proportional diet which is good amount of having good amount of minerals, vitamins, as I just enumerated. And sleep early and have a good amount of at least 6 hours of undisturbed sleep. That is very much mandatory. So I think these are the few tips I can give to the youngsters as well as whoever is seeing this particular show.
Yes, doctor, quite enlightened us today. So this discussion was indeed very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from our live audience?
Certainly.
So, our first live audience is asking that does stress cause gray hair?
See, graying of hair again are two aspects. One is yes, stress to some extent. If you're not eating at the right time, not taking the right nutrition, that can also lead to graying of the hair. But usually, what we have seen is more genetically related and sometimes water related as well. Some people who are staying in areas which have very hard water, like they say, lots of salts and minerals are there, that can contribute to the graying of the hair. Plus, those who are on very high medications and have been taking strong medications for a long time, that can also lead to graying of the hair. Using too much of strong chemicals and shampoos for the very harsh shampoos can also lead to graying of the hair. So there are multiple aspects, and again, genetic is one component. If there is a person in the family who has, like if your mother or your father had a graying of the hair at a very early age, then it can come down to you as well. So
Okay.
that's the reason of gray hair.
Okay, so doctor, we cannot stop the graying of hair, but no, I mean the gray hair cannot be like converted into black. But can we stop the graying of hair like for the young people?
Yeah, still like to some extent, yes, we can control the graying of the existing hair which are there. So again, in that case, we do give some supplements, which again, as I said, the minerals and vitamins are equally important for the. Usually, when we say it's a vitamin B12 deficiency, which are one of the key reasons for the graying of the hair. So there we need to get the levels checked. Again, iron is also one of the contributing factors. So we need to get the levels checked, and if it is very low, then we need to either give injectables or maybe some systemic oral supplements. Apart from that, as I said, even sleep or equally important to improve the growth of the hair, as well as even in the graying it helps. So see that you sleeping well, taking a good amount of sleep, not using too much of the computers as well, because even the infrared light tends to decrease the color to some extent because of the radiations that can also lead to the graying of the hair. So that is one aspect which we need to consider as well.
Okay. So when we go out in the sun, we can cover our hair.
You can cover your hair. Yes. Yes.
Okay. Quite interesting, doctor. So this another question is, this person is saying that he has a thin hair, and someone told him that shaving and trimming the hair make them grow back thicker. So
I think it's just a myth, because see, when you're shaving the hair, is just the hair or the hair shaft. You're not doing anything to the roots of the hair. But yeah, when you shave off the hair, and if you're applying the topical applications, then yeah, the penetration is much better, because there is a bigger area where you can easily apply, and you can wash it off also quite well. So
mhm,
that could be one of the reasons. But there is no particular rule of shaving causing the thickness of the hair to happen. That's
mhm,
absolutely a myth.
okay. Okay, interesting. Another question is, uh, now, does castor oil make hair grow faster?
See, it's ultimately just having omega-3 fatty acids in it. So, yeah, it might help to improve the quality of the hair, but it will not promote any new hair growth. Whatever existing hair is there, because of the omega-3 fatty acids, vitamin E, it helps to take care of the dryness. Because if you have a dry hair and a frizzy hair, it tends to look very untidy, and you feel that your hair is looking limp and thin. So, when you're using omega-3, which is there in castor oil, it tends to make the hair look moisturized, and that might give you that feel that it is looking more thicker. So yeah,
Mhm,
castor oil is good, but as I said, like, use it in a less quantity, because it's very thick, and
mhm,
if you leave it for like long hours, then that can cause more dust and dirt to be accumulated, and causing the hair loss to be increased still further. So as I
mhm,
said, oiling, as I said, just 1 tablespoon is more than sufficient for a length of shoulder length, and use it 2 hours before the shampooing, and get rid of it. So again, castor oil being a very thicker oil, you will need more shampoo to get rid of it. So use less quantity, use it for just 2 hours, and then rinse it off as early as possible after 2 hours. Don't keep it like for overnight or for 3 4 days. That is going to cause the problem to worsen further.
mhm, mhm, mhm. Okay, so another question is, this is quite interesting, doctor. As you said that dandruffs are of different type, is there any home test available where I can test, because I have a dandruff, and I should go and visit the doctor?
A home test is just combing your hair, and if you see that the flakes are falling on your shoulder, that's a dry dandruff.
Mhm,
And if it's sticky, like you have those flakes which are sticking onto the scalp, and
mhm,
when you actually need to scrape it off, and then you can see that greasy yellow thing. So that is something known as a sticky dandruff, which you call it as seborrheic dermatitis, which is very itchy. Of
mhm,
course, we do a trichoscopy examination to see exactly it's a sticky dandruff or a dry dandruff, because that helps us to analyze it still further. But this
mhm,
is just a basic home care test which you can do. So just brush your hair and see if the dandruff is falling on your shoulder, or it's still sticking to the scalp. So that is one thing which you can check.
okay, okay, interesting. Another question asked by our viewer is, do frequent haircuts help hair grow faster and thicker?
Yeah, sometimes like what we understand is that when the hair is damaged,
Mhm,
if you just trim it off, so the split ends are just removed,
mhm,
and if the hair is a little shorter, then you can apply the applications well.
mhm,
And again, as I said, regular washing is also equally important. So maybe getting a haircut maybe once in 3 months should be good enough.
Okay. And another quite interesting question. I have a bald patchy hair and my center portion is shining. So that means I can go for hair transplant.
See, hair transplant is a very we need to check first of all what exactly is the pattern, because if it's just a small patch, then it could be just an alopecia areata. Now, alopecia areata is a totally different concept. I mean, it's a different problem because it's an autoimmune process. So in such cases, we don't do a hair transplant in the first place. Alopecia areata people are totally contraindicated for a hair transplant. So we need to check exactly what is your problem, whether it's a alopecia patch or it is a proper androgenic alopecia. So for that, you need to meet your doctor. We need to do a thorough analysis. We need to see your lifestyle, your history, your family history, and then, of course, do a check as well. And then accordingly, we can guide you as to what will be the treatment for that.
Okay, okay. So we are running out of time. I will quickly take the last question of the same person
Sure.
who asked for the alopecia. He said, "Okay, doctor, but I have been asked to take vitamins and minerals and other medication for lifelong. So, is it true that I have to take it for lifelong?"
See, now if you're having a male pattern baldness or androgenic alopecia, then you need to take medicines as long as you want your hair to be there. Okay, that's a simple basic thing, because see, when it's a male pattern baldness, it is totally related to your hormones as well as a nutritional deficiency. So maybe you can take a break. If you're taking it for a year, then you can take a break for a month or two and then again continue it. But yes, you need to take the medicines as long as you want your hair to be there. I mean, I will not give you wrong guidance, but yeah, when you need supplements, yeah, you need to take, because you have been, now you're young enough and you're taking the supplements and still you're having a hair fall. But when you grow older, your system is also weakened, your digestive system is weakened. So there, whatever you're taking, anyways, is not going to be absorbed as you are at this age. So there again, you need supplements to support whatever is the existing roots of the hair. So that is again, if your lifestyle is good, your sleep patterns are good, you're eating a healthy diet, maybe that this is something which you're going to give now so that your long-term gains are better. So it's going to be like a, what do you say, a helping hand to each other. This is what I can say. So going hand in hand to your diet now will give you the returns in the long run as well. So that's how you can put it.
Overall balance is the key.
Yes, yes, balance is the key.
Yeah. So, doctor, would you like to give a take-home message or suggestion to our viewers today?
I would say that particularly to the young generation, don't get carried away by people's ideas and whatever the media as well as whatever is shown in the what do you say, the advertisements. Think sensibly. See if you're having any problems or concerns. Get the right guidance. Take control of your problems at the right time. Take the right guidance. Meet the right doctor and take the right consultation. Apart from that, have a healthy lifestyle. As I said, like don't don't sleep at late nights. Try to have a cut off screen time, because that is going to hamper your health in the long run. So try to cut off your screen time. Try to sleep early. Get the right amount of sleep. Eat a healthy diet, a nutritious diet. So once in a while, if you binge, it's fine, but doing it on a regular basis is going to cause all the other health problems apart from the hair loss. So, right time, if you awaken and you take the right step, it is going to be fruitful in the long run. So, these are the few things, tips which I would like to give to the young generation. And apart from that, those ever who are having any other issues, see that you're taking the right guidance. Just don't follow things blindly from your friends or from your in-laws for that matter, or from your mother, because see what they have faced and what you are facing is totally different. So I won't say that it will not help, but then you should be taking it in the right way. Just following blindly is going to cause worsening of the problems, and then there might be a time where we also cannot help you out. So rather than having a worst case and then coming to us, it's better to come at the right time, so that, or maybe any doctor for that matter, you have to come at the right time so that we can give you the right guidance. Take care of in the means whatever procedures, if you want to give you, like maybe PRP or meso. So these are also going to be supportive to you. Apart from them, the nutritional supplements, as we said, in the nutraceuticals, that is also going to help you out. So a right guidance is what is the key thing, because if you are getting the right guidance at the right time, that is going to help you uh, to prevent the damage rather than coming with a worse concern.
Prevention is better than cure.
Better than cure. Very true.
Yeah. Thank you so much, Doctor, for sharing so much of information and all your expertise with us today and for answering all the questions of our viewers. I'm sure viewers have found the session very helpful. And thank you, Doctor. It was a delight to have you. And thank you so much for your valuable time.
Thank you, and it's my pleasure to be with you. Thanks a lot.
Thank you so much, Doctor. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for